I'm Evan Minty. I'm a general internist. I work out of the University of Calgary. Part of our clinical service there is in perioperative care. This work group is co-led by myself and Jenny Lane, who's an orthopedic surgeon at Queen Mary University in London, and also has had some great leadership from the Center for Surgical Sciences through Andreas and other participants there. So I'm going to describe you, actually, to start this presentation. You are interested in providing or generating evidence that improves clinical care, but you're tired of trying to figure out if your patient has type 1 diabetes or type 2 diabetes or both or neither in an observational record. And you're tired of seeing patients migrate in and out of system and in and out of data sets on timescales that were important for you looking for your outcomes. Within surgical sciences, we're interested in fairly distinct procedures that we think we can identify with high fidelity in a data set, and then we're interested in the next 60 days. And if that patient is captured for that next 60 days, we can learn a lot about their outcomes in that perioperative period. And so that's the goal of our work group, is to collaboratively generate the observational health evidence needed to improve care in that perioperative period. Our themes for our OKRs are across these areas: work group growth and processes, cohorts and characterization, community events and community evidence generation, and perioperative prediction. Go ahead. So for work group growth and processes, we'd love to have you guys on board. We'd also would love to involve at least 3 new members from 3 different surgical or perioperative science focused lab groups. We want to be creating an interface with the clinical community by presenting our work and OHDSI's capabilities in at least 1 surgical or perioperative medicine focused conference, and continue to establish strategic collaborations with other work groups in our community. Go ahead, Craig. Within cohorts and characterization, we need to finish some important work that Chris Knowles and others have really been instrumental in catalyzing. That's completion of the how often incidence rate characterizations across the 3 different studies that we have running there, and completion of a hip fracture study-thon through a network study that Jenny Lane is planning. We also want to explore, and this is some work that the CSS is very interested in looking into, proxies for pre and post-operative functional outcomes within the OHDSI network. So there may be data sets out there that might not have been subject to ETL within our network of databases that have a bit more in the way of physiologic testing pre and post surgery, and we'd like to see if we can bring that data forward into our network to get a better idea as to more gold standard proxies for post-operative and preoperative function. For community events, we'd like to support at least 1 surgical cohort hackathon, largely focused on refining and creating new surgical cohorts. Go ahead, Craig. And finally, a big push this year will be the execution of a perioperative prediction study jointly with the PLP work group, looking at using the major non-cardiac surgery cohort and other surgical cohorts against outcomes of postoperative interest. So that's something that we'd like to push forward by the end of the year. And that's it. Please reach out. My coordinates are minty@ohdsi.org or through the work group signups that Craig had mentioned.